First and foremost, I'd like to thank you for being here today. It is truly a pleasure to organize this education sessions. You know, we've been doing this for over 30 years, and we are truly excited to be here with you. We have learned that education is one of the most important things in consulting. If you know what's happening in the industry, that will help you to make better decisions, and it will truly help your employees and their families as well. Also, we want to welcome our clients from out of town. As you can see, we have an amazing camera back there. So welcome and thank you. We hope that one day you can join us in person here in beautiful Kelowna, British Columbia. My name is David. I am a group benefits, pension, and human resources consultant with ENCOMPASS Benefits. Let me introduce you to our team. So here we have Brett. He's the principal of the firm. We have Christy. We have Karen. Where's our team? Kathleen as well. So, and Carol, right here. Not everyone was able to make it. As you know, we have some people in the office taking care of the calls and the emails. So we want to support you as much as we can. If you have any questions, let us know. We also have name tags, so feel free to mention anything. Okay. So we're super grateful to have you here today, but also we have special guests. From many different paramedical professionals services here in Kelowna. We have Greg from Wave Physiotherapy. Thank you for joining us. We have Troy from the core, Sarah and Pam as well. So I'm going to invite them to join us at the front, and we're going to get started. Okay, so please.
Everybody?
Yes, please. Yeah.
Okay.
Yeah. And now Brett is going to.
Well, good morning, and of course, welcome to you as well. It always touches my funny bone when David, who just had his 25th birthday, says, "We've been doing this for over 30 years." Thank you very much. Hey, folks, thanks so much for joining us. We really appreciate it, and it's been kind of interesting as we've been preparing for this education session, and the idea was, hey, let's have a panel of paramedical practitioners join us and talk to us a little bit about their industry and their specific discipline, and a little bit as it relates to or doesn't relate to the other areas of paramedicals. So, Greg, welcome here.
Thank you.
Thank you. Troy, Greg is our physiotherapist, Troy is our chiropractor, and Sarah is
Chinese medicine, acupuncture.
acupuncture, thank you. And everyone's favorite, the muscle rubber, aka massage therapist Pam. Thank you. We've been working hard to really create some lively discussion today. So can I just do a mic test on everybody?
Sure.
Hello? Hello?
Hello.
I think it works.
Greg's might be up a little bit here. Okay. Sounds good. So first up, if each of you can spend just 2 minutes sharing some of your personal education experience, and then explain the focus of your practice and specialized area of discipline. So Greg, why don't you lead us off a little bit?
So I'm a physiotherapist. I have two degrees, one from Simon Fraser in kinesiology, and one from Queen's University in physiotherapy. I'm a fellow of the International Federation of Manual Therapy. I have a diploma in sport physio, and I'm a clinical specialist in chronic pain and sport, which is sometimes people get confused, but they're very different, but sometimes the same. I've been to 6 Olympic Games as a physio, and I'm the head physio for Golf Canada and Canoe Kayak Canada. Sorry, what was the question?
The specific focus of physiotherapy and what's specialized about that.
So physio is quite a large realm. I'm involved in orthopedic physio or musculoskeletal physiotherapy, but there's also a sort of a cardio risk and a sort of stroke neuro rehab component to it. Those you'll see sort of more in the public system. The private system, and what most people sort of think about in the physio realm would be orthopedics. So that's your sort of sports stuff where you injury your knees, your shoulders. But more and more so we're seeing your wear and tear type issues, so your spinal degeneration, your hip, knee stuff, and then a lot of neurological issues in terms of nerve dysfunction. And so they're probably our specialists. But at our clinic, we also specialize in sort of pelvic floor health. I don't do that, but we have specialists in that, and then there's hand therapy specialists as well. So yeah, that would be where we go with that.
Great, thank you. Surprise?
I'm nothing like that.
Which is why you're here.
Yeah, exactly. Oh no, I'm a lot like that, but just not that in depth. My name is Troy Tater. I'm a chiropractor. I've been a chiropractor for 17 years now. I have my Bachelor of Science that I finished in '96, and then my doctorate in 2000. I practiced all over Canada, so I had 3 practices in Manitoba, 1 in Saskatchewan, and then I finally said enough of the prairies and came out here and opened the 4. These 2 lovely young ladies joined me. The specialty in what I do as a chiropractor is we literally work on everybody from young kids to my oldest patient right now is 100 years old, and we deal with a variety of different things. I mean, you put your body, even just sitting here all day, all morning, you put your body in positions that they're not used to, and maybe it brings up some old injuries, you cross your legs like that, which is going to strain your pelvis a bit. And that's the day-to-day stuff that we see. And now within chiropractic, I've gone on to specialize in this other technique called the Cox technique that I get, luckily, a lot of referrals from surgeons and medical doctors in town, where I focus more on like discs and where you get neurological sciatic pain down to the toes, where people aren't getting out of bed, let alone going to work. And that's kind of my focus in my clinic. I'm the same as Greg. Is there any part of the question?
Well done. Thank you.
Hi, I'm Pam Dhillon. I got a diploma in massage therapy and I graduated in 2005, that's right. So I've been practicing for about 12 years, 6 years before. Before that, just through Vernon in Vancouver. The thing that we really work on is the soft tissue, basically with your muscles, your tendons, your myofascia. So basically working with people who have prolonged postures, sitting at a desk all day, having a tucking posture, having those kind of issues that happen in the body, having those stressful postures all day long. So that can cause a lot of strain and sprain to your body as well. So we're working with tendinitises, bursitis, we're working with any kind of like pain syndromes with like low back pain or whiplash. So anything that really that has to do with the soft tissue of your body, muscles and fascia and ligaments and tendons. That's pretty much what my focus for my job is. And
Thank you.
Yeah.
It's great.
Hi, I'm Sarah Jenkins. I'm a traditional Chinese medicine practitioner and acupuncturist. I work with these to the core. Chinese medicine is regulated in BC. It's a full-time 4-year program. What else can I say? I did a postgraduate program, a 2-year postgraduate program after I finished school in Portland, Oregon, at the Institute of Classics of East Asian Medicine. I guess my clinical focus, what I see a lot of, is people that have chronic, complex health problems. So people that maybe don't get answers through traditional conventional medicine. And they may be on a lot of medications and they want to get off some of their medications, or there may be no other solutions for them. So for example, people that have long, migraines for their whole life, and that would be somebody that I would treat. Pain is something I see a lot of.
That's great. Thank you. In about the same amount of time, and this is a history question, but if you can give our audience 5, 10, 30-year history of kind of the evolution of your area of discipline, what would be some key benchmarks in your particular field as to how it came to be what it is today. So way back when it started, and then perhaps kind of midstream, and then where it has evolved to today. So, Pam?
Sure. Well, way back. Gosh, massage therapy has been around for thousands of years, but it started to get researched first in Europe in like a few hundred years ago, really. And then it was the 20th century, late 20th century, when it started to get more researched in North America. For Canada, Ontario kind of led the way a little bit with first regulations, and then BC followed closely after. We were regulated first with physios and massage in the 40s, and then mid-90s is when we got our own regulation in British Columbia for our own association, which allowed us to have our own professional standings, have our own regulations and our own standards for our schooling. So we've been in that same regulation since the 90s. And then we've changed our scope a couple of times and revamped our practice, and the current scope has been, was written in 2001, which we're currently working under. And the schooling has changed a little bit. Like I did a 3,000-hour program. Now it's more kind of trying to go provincial, across province regulations, so we can have more therapists kind of able to move across country and not just be stuck in practice.
That's very good, actually. I'm glad to hear that.
Yeah, and so we're regulated with Newfoundland, Ontario, and BC have the same regulations. You just have to do the jurisprudence exam if you were to move across province. And now we're working on more provinces to up their standards to what we have, so that we can easily cross province and give the same healthcare across country versus just in the provinces. So that's what we're currently working with.
That's great, because we have had some clients that have received services from a recently moved from Alberta province or wherever, and the carrier said, no, it's not covered because they're not a registered practitioner in this province. So that's great.
Because Ontarians, the standards of education here are a little bit different than, so we're trying to just have the regulation come through.
Good.
Yeah.
Troy?
A lot of, like in 5, 10, 30 years, chiropractic really hasn't changed a ton in regards to the scope. I mean, everybody basically, I think, knows what chiropractors do and what we are. Going back before that, I mean, chiro was started in 1895. Kind of a cool story how it happened. So the founder of chiropractic, he was an orthopedist, and he had this one janitor who came in. His name was Harvey Lillard, and he had recently had something fall on his head, and he lost his hearing. And so this D.D. Palmer is the guy's name that developed chiropractic. He said, well, this doesn't sound right. So we started doing a lot of research on the nerves of the neck and what could have happened. And probably about 2-3 weeks later, he took a book and put it on the back of the guy's head and smacked the book, and the next day the guy's hearing came back. And that was the birth of chiropractic. When they realized that, wait a minute, there's something here, and nerves do get affected. So, and then, I mean, like I said, the last 30 years, not a lot has changed. But, you know, even as late as the 40s and 50s in the US, if you were a chiropractor and you were adjusting people, you could be sent to jail for practicing medicine. So, from back then to now, in Canada, we're considered primary care physicians, so portal of entry docs, where you can come to me, you don't need a referral, and from there I can then point you where you need to go, do an assessment as what I would say is I'm a doctor first, chiropractor second. And then from there we get to decide, are you a chiropractic candidate? Is it more physio? Is it more go to your MD, go to your neurologist, whatever the case may be? And of all the provinces I practice in, this one is the furthest behind every other one. Every other province I've practiced in, if you need x-rays, CTs, blood work, you're there the same day. I can send you to the government lab. In this province, it's the opposite. Like, we're village idiots, is the way they look at chiro. So, even though, like a medical doctor friend of mine said, he goes, I've looked at your education. You have 950 hours on x-ray and CT and MRI reading. And he goes, I have 50 hours. How come they have to come to me to get an x-ray when you know how to read them and take them and everything? And that's just a little bit of the problem with BC right now, is they're a little bit behind.
Appreciate that.
Yeah.
Sarah?
Sorry, what details do you want?
So this is a bit of a history in terms of,
Okay, well,
and I can't go back too far at the
I
time.
know.
We do have a time limit.
Is the longest
Okay.
consistently practiced medical system that humans have used. I guess in BC Chinese medicine has been regulated since 1996. In BC, there's 3 levels of licensing for practitioners. There's registered acupuncturist, traditional Chinese medicine practitioner, and doctor of Chinese medicine. Each level of licensing has education requirements and you have to write licensing exams. Our scope of practice is changing right now in BC. Right now, MSP can cover $23 of each person's treatment if they're under a certain income level. But our scope of practice is changing in that the herb part of Chinese medicine is not currently covered. But our association is trying to include that into our wider scope that should be covered. So the actual herbal consult part, not the herbs themselves, but people can sometimes write them off their taxes. In North America, I would say Canada is a little bit behind. In the States, there's a lot of states that have acupuncture in hospitals. And even in some hospitals, they have Chinese herbal pharmacies, like in Texas, they have some. I know some people that work in integrative medicine centers in the United States, and it's been really good for patients down there because they have more choices. Some people sometimes medications don't work for people, and they want to try something else and not be reliant on medications. So it's a good option for them. So I hope that is going to come to fruition in Canada eventually. We're a little bit behind here.
Great.
Yeah.
Thank you. Great.
So physio started in Sweden in 1813. The gentleman was milking his cow, and the cow. I'm sorry, just trying to keep on.
I like that. Keep going.
That's good. I was wondering what library you had.
You got my tennis elbow. I can see it. It's good.
It did start in Sweden, not quite as gloriously, but really during the Second World War it became really useful, obviously fixing people that came back from war, like amputations and things like that. In the 50s was when we sort of joined the Healthcare Act, and so we heavily regulated. The good parts are you can have direct access to physio, you don't need a referral, you don't pay tax on physio, things like that. The bad part for us is that we're heavily regulated in terms of our college, how we can advertise, what we can say about someone else in terms of if you're better than them or anything like that. It became a university degree in the 50s. It's a master's program now. In the US it's a doctorate. And really in the last 30 years has been the greatest sort of research, evidence-based medicine has been a big thing. And the postgraduate research in terms of what we do, from needling to pelvic floor exams to hand therapy, has really escalated, and we now have these sort of tiers of clinical specialists or fellows. So that's really changed the level of training of each physio, and it's very different. Although we're not allowed to tell anyone that it's very different, but one person will go to one physio and then come back to another physio and say, why is this so different? And that's sometimes the frustration for patients and benefits providers, is that there is a vast difference between practitioners, but again, unfortunately, we're not allowed to say which one's better and what. But you can say that you're a specialist if you go through a special program, but that takes about 2 years to be vetted. So now it's a clinical master's, and yeah.
Great, thank you. Tell us a little bit about your largest block of clients in terms of the majority of your clients. Specifically, the most common physical ailments that would seek your help for treatment, and what specific unique benefits of your discipline versus the rest of other paramedical practitioners. So your largest block of clients, and what primarily physical ailments and unique benefits. Go ahead.
Definitely pain is number one of every kind, whether it's an injury like repetitive straining, back pain, neck pain, headaches, abdominal pain, gynecological pain. That's probably the primary thing that people think of when they think of acupuncture and Chinese medicine. And then I would say, like, once people get in the door and you start talking, people usually have a lot of other things going on. And sometimes those other things are part of the picture of why they have that pain. So I might put them on herbs if they have endometriosis, for example, to help break down stagnant blood in their reproductive system, so that will reduce their menstrual pain. And then do some acupuncture to help reduce the pain that they're experiencing right then. So I would say just pain is probably the biggest thing.
Thanks. Troy?
The largest occupations I see, I'd say the same as Sarah. Usually it's pain that brings people into the clinic. The latest video I did on my clinic website, I started by saying I'm so tired of the word normal. Like, people think as you get older, it's normal to have headaches, it's normal to have back pain, it's normal to have knee pain, and that's what I'd like to change. Is that all of us, that's what we deal with, is teaching people what a new normal is. You don't need to have that. It's not part of getting older. Arthritis does exist, but you can stave it off. And so I would say the biggest thing that I see is pain usually, and we get you out of pain really quick, and then you understand what it is that we're doing in regards to fixing the problem.
Pain in what areas of the body, though, for chiropractors?
Chiropractors, unfortunately, it's usually it's either the lower back or the neck, usually.
Okay, thank you.
And then in regards, again, to what I specialize in regards to more complicated lower backs that I get the referrals for, it's usually static pain, like right down the big toe or going into the groin or something.
Okay.
And it's the hands.
Great, thank you. Great.
Spinal pain, spinal degeneration would probably be the number one thing that we see. And then combined with hip and knee joint pain, mostly wear and tear. So your classic, probably our main demographic would be 40 to 60 years old. Females more than males, generally because females will take care of themselves and will actually address the issue, whereas males will go and they're like, now the busiest day of the year for me is the Monday after the Masters golf tournaments, and that's because every male has gone out and hit 1,000 golf balls and realizes that pain that they've been that's been annoying them all winter is not apparently going away, and it's going to get in the way of their golf year. So, but generally, wear and tear would be the number one. I mean, obviously now, certain things like concussions for the younger athletes, and some acute stuff. But I'd say number one thing would be hip joint, joint pain and spinal and hip and knee. Yeah.
Great, thank you.
Yeah. Pain seems to be the topic. Definitely for that as well. But I think being with a massage therapist, you kind of get people who are coming in for stress relief as well. So not necessarily pain, but a lot of high stress in their day-to-day. It can be work stress or whatever as well, but also people in prolonged posture. I've got a lot of people who work at a desk who are in this position all day long, and it's causing a lot of tension throughout their body. So it's not even necessarily pain, as more pain as well as tension, as well as stress relief. People who can't sleep well after a busy day and their minds are brewing. It's, typically I think I see more chronic things, though I'm totally capable of seeing acute as well. But I think that a lot of what I get people with even just the tension headaches, lower back pain, tennis elbow from or typing all day from joint, that kind of thing. There are postural concerns, that type of thing. So upper back pain. So usually more people kind of think of massage therapy about being like a back and neck kind of thing, though I can definitely work on things, but I think people are always surprised that I can treat an ankle or whatever as well. So I think commonly though it's more whiplash injuries and that type of thing as well.
Great, thanks. I see you have a pen and paper, so I'm just going to spread these out here, one for each. Oh, that's good. This next question, I'd actually like you to write your answer down, because I don't want the answer to be influenced by, yes, although we do trust you, of course. If you looked at the largest segment of your clientele, how many times, and I'm asking this for our audience here, how many times would you normally see your clients in a year? So give us an estimated range of the most common. Would it be like 2 times a week year-round for years on end, or it would be 2 times per month for 3 months, or 2 or 3 times and then they're done, and you typically wouldn't see that person for years, right? So how would you describe your typical largest section of clientele? How many times would you see them?
In a year.
Yeah, let's say in a year. Thank you.
But see, a lot of that would be based on, they come in with an acute injury.
Right.
Is this something that?
So this would be your typical largest block of your clients, okay?
Okay.
Because I know we can talk about the bookends. I see one guy, I never see him again, or I see this person, 8 days a week.
Okay.
Okay? Great.
Well, there's sort of 4 big categories, I guess you could put it. So, I mean,
So you have a 4 section for a simple one answer. Okay. You have a 4, go ahead.
Is different.
Yeah, I know, I'm trying to narrow this down just
So,
a
I mean, the
little bit.
largest group would be ICBC,
Okay,
and that's just the nature of ICBC and
Right.
motor vehicle accidents, and that would be 16 people, 16 visits a year, let's say.
okay, good.
Chronic pain, and chronic pain, the definition of that would be your person that we get from the interventional pain center. These are people that are barely coping in life, and that's one of our specialties that we deal with. So this is a lot of neural pain. It's not just like your sciatica. This is like whole body pain. When the person walks in and we ask them to measure on the human body where the pain is, they color the person in. Do you know what I mean? Like when we put a person put an X, like the pain is here. These people color them human in, right? So there's a lot of pain. So for pure musculoskeletal issues, so what most people would come into 5 times a year, and then just your spinal degeneration. So your classic, 50-year-old male with low back pain. When we get the X-ray, it looks pretty horrific, but Dr. Governor, the neuro surgeon, does not want to touch them. For those people, it'd be 6.5 times a year.
6.5, thank you.
Yeah.
Very detailed.
Troy.
I took the stats yesterday.
I did not check the stats. I mean, before I show you this number, mine's just a simple answer.
Thank you.
Okay,
Yeah,
so
appreciate that.
I'll tell you one thing I hear from patients all the time is, I hear with chiros, once you start, you can't stop and you got to go all the time. And what I say to people is, if you take a bag of apples and you put one rotten apple in there, it's going to start to spread. So my answer is 12, but there are colleagues of mine in the city that would probably multiply that by 10.
Okay.
So a lot of it depends on who you see and what their mentality is. And
Right, because some of the challenges are practitioners, whatever they are, make an appointment on your way out. So that's kind of one of the reasons why I'm asking this question. And we as HR managers and business owners are just continuing to see the challenges of the rising premiums. And that's why we're kind of asking that question. Pam, go ahead.
Again, it varies with every person, but on average, probably once a month all year, so 12 on average. Again, with different conditions, it's going to totally vary, more once a week if you need it, but I think on average, maybe 3 to 4 weeks. But it's like all year round, it's not just like after 3 months are gone, because it is a chronic thing that I'm usually working on for people who have the same posture for 8 hours a day.
And I'm going to pick on massage therapists a little bit, because we have probably seen massage therapists run away on us more so than any other practitioner in the industry.
Yeah.
And would you say most of your clients are on a regular schedule and they just keep going back and they're probably going to come back again for the rest of their life? Or would you say the majority is seasonality or for a period of time and then the next time that they might have an issue?
I think that if somebody has an issue, like actually an injury, then I see them more frequently, and then I do get them to come less frequent. And then they are on a maintenance program for once a month or once every 2 months. But it all depends on, I think, what their job is. So I try to encourage people to, if it's like their prolonged posture at work that's causing the issue, I try to ask them to get a referral for an occupational therapist to come in and reassess their workspace before they keep coming back to me over and over again. So the education on those referrals are something I really do a lot of. Give them tools at work so they can kind of come less frequently. So I've got a busy practice. I don't need to see everybody that often, honestly. Like I've got a huge wait list. I don't really have room for people coming in just to get fluffed around a little bit. Like I really need to make space. So I'm not a person who try to pour patients and get them to come in once a month when I don't need to see them. So I try to educate and get them to do home care, and discharge them. But yeah, I mean, everybody likes to get a massage.
We've noticed.
Yeah.
Great, and I might just stay with you for a moment. We have heard you say, and I think our audience heard, that it is more of a stress release as well, or versus I've had an incident, therefore I need to get some repair fixing done on my body, versus I need to go in for more of a mental perspective than a physiological. Talk to us a little bit about that, and we're going to...
I think that it's not just, it's both. It's totally both. You can't just go that I only work on people with or stress relief or whatever. I think that I have people come in straight after a car accident and they need a lot of physiological help. They're in pain and they need to change their actual, the soft tissue needs to be repaired. But there is...
Which is the original intention of physiotherapy, but what I'm saying is it's kind of moved into more the mental piece on the on the massage.
And people these days, I think, have higher and higher stress for whatever reason. They're kind of really living in this high stress kind of world. Everything, I'm not sure what it is, if it's just screens or what. But that's a big thing for them. So they have trouble sleeping. Their minds are going. They're telling me the stresses are 7 out of 10, and they come in and they get to actually be, just taken care of, be nurtured, have time to breathe, time to relax. Those people are half asleep on the table thinking this is I barely slept all night. I woke up 5 times last night. I only slept for 5 hours last night, and they finally get that a little bit of relief, just being able to, put their head down for a minute and get some circulation going and release some tension. So I think that for the mental capacity of massage therapy, I think it's been a huge help for people just to kind of cope with their day-to-day.
Right, which enables them to come back to work and be functional part of society. Okay, great, thanks. Sarah.
Generally, when I see somebody for the first time, I put them on a treatment plan. So I try to identify what the goals are that we're working towards first. So not everybody that comes in, like what I see as what's going on with them, not everybody wants to completely resolve every issue that they have. So I try to identify like their top 3 things, whether it's like, I want to be able to sleep for 8 hours. Or if somebody has I just brought one of my treatment plans, this person has psoriasis on 90% of their body. So they want to have less psoriasis,
right.
And then all the things that kind of tie into that with their digestive system and all that kind of stuff. So then the treatment plan is designed to address those goals. So typically, initially, I see them more frequently. People that have more of a complex picture, I will try to put them on a formula that addresses that so that they can start having changes happen faster. You can take herbs for pain syndromes too. Herbs are very effective for pain. And they don't have the same side effects as painkillers. So typically, initially it would be like maybe once a week for about a month till enough momentum is built with the treatment, so they start seeing results. As soon as they start seeing changes, then we start spacing their treatments further and further apart with the goal of eventually getting them to a maintenance thing. And I try to address some of their lifestyle stuff that is contributing to the problem too. So, for example, like Pam was talking about like stress and some of the psychological stuff that are part of the picture for a lot of people's health problems. So I try to address that. I teach people about meditation, relaxation techniques, the importance of self-care, and just lifestyle, making sure you're going to bed at a decent time, getting enough sleep, getting enough water, managing your stress, like all the different facets that contribute to people's health. I try to kind of incorporate that into their treatments as we go along so that they're getting an education too on how to take care of themselves.
Good. Thank you. Last question, and then we're going to give our audience a chance for some questions as well. Tell us a little bit about your perspective on the integration of your practice and the traditional doctor. we've seen a major increase in our paramed costs for each of your specialty over the last 4 to 5 years. And we're not anticipating it's going to trend down either. We anticipate it's going to continue to go up. Why is that? And is it becoming instead of regular medicine, or would it be in addition to? Who would like to go first?
I would.
Oh, wow. Ladies first. Go ahead.
I think it's both. I think I see patients who, they're on tons of medications and they can barely function because of the side effects of their medications, and they definitely want to be on less medications. And then people that they're like, I don't want to take any medication even though they're in tons of pain, and they're looking for other ways to kind of help themselves. I've had lots of patients who are doctors themselves who have, medical doctors also have health problems, and a lot of them see the side effects of the medications that their patients are on and don't want to be going down that road themselves. So I think the future of healthcare is integrated medicine. I do, because I think the medical system has gotten really expensive to maintain, and people see the side effects of being on a million medications, and they want to know what else they can do, and there's tons of options. So.
Great, thank you. Troy?
I kind of forgot the question, but
Integration between your practice and regular medicine.
yeah.
And is it in addition to or enhance?
I would say for sure in addition to. The way I always describe what all of us do is it's like a giant pie. And what Greg specializes, like he said, joints and degeneration of the spine. Mm-hmm. I have a different pie that I specialize in. That's more of neuromusculoskeletal, like how the skeleton affects the nerves and what that means. And then the girls have another piece of the pie, same with an MD and specialists and nutritionists. Like everybody's got this piece. I think what you're seeing right now is a bit of a paradigm shift. People are saying, hopefully, for once, am I treating the cause or am I treating the symptom? Mm-hmm. And I think that's the biggest thing you're going to see is that people are starting to say, why do I want to take a medication for an inflamed joint that's then going to cause me to not sleep? So I have to take a sleeping pill, and the sleeping pill then causes me to have headaches, and it just cascades on and on. So I think a lot of MDs, the same thing. Like I said, I'm lucky I get a lot of referrals from them, where they say, you make me look good, because now I've got an avenue to send somebody for a certain avenue to say, listen, let's get you fixed. And so I think that's the reason why you're seeing a rise is the world is waking up a bit to say, wait a minute, there's not one thing is better than the other. Right. There's quacks out there in every single field, but there's more than one option.
Great, thank you.
Yeah, I think that people are getting just more educated and they want to know about non-invasive, non-surgical options. They don't want to be, necessarily cut open because they've got a carpal tunnel. They go, okay, there's options to do something that is non-invasive, that I don't have to have scar tissue over. I don't have to be out for weeks because I've got this injury. I don't want necessarily a horizontal injection in my joint because that causes side effects. I'd rather just get it manually treated. So I think people are getting a little more aware of the side effects of invasive surgical kind of procedures and want a different avenue that's going to, again, target the actual issue, not just cut you open and take it out, but actually just repair what the issue is. And I think that's a beautiful approach. I'm really excited to see people have that paradigm shift and really kind of start to educate themselves. I think also like Greg was saying, there's been a lot more evidence-based research on things like physio, chiro, massage in the past couple of decades, and so I think that's really helpful as well. People will be reading more about the things that we do, the things that we treat, and I think that's awesome. So, but I also see it as a parallel too. There's never a time where I'm going to say, well, look, I also really value the medical doctors, and when I need to refer to them, when there's something that's not in my scope of practice at all, or something that's just, you can see that it needs a different type of intervention, and that's something I'm not afraid of doing, is referring on.
Great, thanks. Great.
The increase in paramedical, I think, is probably the fault of two people. That's the family doctor and Jeff Bezos. And the reason being, Jeff Bezos is the owner of Google, if you're wondering who that is. And the reason is that there's less and less family doctors around and less people have one. Unfortunately, it's going to get worse with the new tax reform coming down. They're going to work less, and the number of people that come into me that have a family doctor is declining rapidly. So what happens is the person's got pain, so say it's in your shoulder, they'll Google and they'll effectively Google, and they'll find out a good reason why, and then they'll look in treatments and they go, oh, physio. So they come to us, and should try and basically triage themselves, and then because we're primary care practitioners, they know that they don't need a referral, they don't need to ask for permission to come in. So they come in, and then it's up to us, and it's unfortunately some of our responsibilities now to refer them back to the physician or refer them on to someone else, like Troy or Hannah or something good to get, because it's not in our scope of practice, and it's not just a purely MSK thing. So we become these referring outside people, you know, and then the other reason is doctors are referring more to us, because there's a backlog in things like surgery, and also people are, like Sarah said, are more inclined to say, I don't want any medication. And the number of people that come into me and said, that say they don't want to be on any kind of, even Advil, but don't touching the stuff. And so they're looking for other ways to try and cope with these issues. And a lot of times now we're realizing we don't fix problems, we manage them. And that's part of why the costs have gone up, is because people are managing things more effectively, but unfortunately sometimes they use extra healthcare practitioners for that management.
Interesting perspective. Thank you. Questions from the floor?
I have one. It might be more for you, or it might be more for Craig. So an occupational therapist versus a physiotherapist. You mentioned hand therapy, but hand therapy, when I went to see somebody, it wasn't done by an occupational therapist, it was done by a physiotherapist, because they said the occupational therapists aren't covered as paramedical. Would that be because our particular plan doesn't cover it, or is that something that is so specialized that, so I just felt like I went to a physiotherapist because I was referred to a hand therapist, but because it's not covered.
Right, so the question is occupational therapist versus physiotherapist. Physio is covered by a benefits plan, occupational therapist is not.
Yeah.
So therefore, sought medical attention on the physiotherapy side. Brief comment on that?
Well, the hand therapists are both occupational and physios, as you know. And I think occupational therapists are slower coming out of the public system, and meaning they've always been covered by the public system, so there's less coverage from benefit plans. And so now you're getting more and more private occupational therapists out there doing things like hand therapy. But I think maybe the benefit plans have been slower to cover them. That's the only thing I can
Interesting.
Yeah, so they said, if it was work safe or ICBC it would be covered, but not if it's.
So if I'm an occupational therapist, could I bill as a physiotherapist? They are different disciplines. Okay. Good. Do some have both? Could I be an OT and a...
Back in the day, like you were a Bachelor of Medical Rehabilitation. So those people are probably very hard to find now. But they would be both an occupational and a physiotherapist. But to find them, there's probably 10 in BC maybe.
Okay, great. Thank you. Good question. Another one? Tracy.
With the internet and all of the information that's out there where you can plug in your symptoms and it works you through a decision tree, do you find it helpful when a patient comes to you and they've sort of gone through that process and narrowed things down for themselves, or do you find that problematic?
Are you asking anybody in particular? I mean, from my standpoint, it's, I always say to my patients, you have to know more about what's wrong with you than your doctor or me. However, from a doctor standpoint, everybody comes in and they think they know what's going on. They think they're dying. And I have to put this face on every day instead of being like, oh yeah, well, I've seen it 9 times today, but you can't let them know that, no, you're not dying. You don't have tuberculosis, but you just let them finish. But Yeah, so I mean, it's good that they have an idea of what's going on, as long as they haven't gone too far down that path where you start to look and say, okay, wait a minute, no, you don't have this rare form of, salmonella disease in your ankles. And that's what I'm afraid of. Sometimes people go too far down the rabbit hole, but saying, yes, I have sciatic pain, yeah, that's good. Now let's deal with it. But so from my standpoint, it's good. It's also, like Greg said, they can really go far down another way where maybe they're not getting the right answers. Because if you do type in shoulder injuries, you might get some weird answers on what's going on.
I like it mostly because the patients thought about what the issue is, and so they're trying to localize what they thought was the problem. They come and they tell you that. But like all of these guys, the problem is never usually this, right? This is where the pain is. So that's trying to figure out what caused this. And if you go to certain websites, you're suddenly down that rabbit hole where you need surgery for this thing. When a lot of times they come in and I'm doing something which is usually not very fun, but where we're using maybe needles or something like that, and it'd be sort of in the mid-back where nothing to do with the arm. And so they're kind of, part of them is thinking like, well, I Googled this and it was elbow pain, and suddenly I'm seeing this Yahoo and he's treating my mid-back. So there's a little bit of education that you have to come up with in terms of why they have that, but I like the fact that they've localized what their symptoms are and they've thought about it, rather than they're sitting there and they're thinking and then they go, yeah, that's right, it's like that. Yeah.
But then they also start to add symptoms in as well. Like I've had people where I wish they didn't know anything about it, just because if you read online, you're like, hey, I've got that, that, and that, and all of a sudden the other three symptoms, they all of a sudden have. So they come in and they basically say, these are all my symptoms, and you're like, oh, well, it's got to be that, and then you assess them and you go, wait a minute, you don't have all these symptoms. You found something that you could relate with and you thought that's what it was, and that gets confusing. I sometimes don't like Google for that.
Sometimes it's good for entertainment. I mean,
Yeah.
They come in and they say I have rhabdomyolysis or something, and you're like, what is that?
Well, Greg, when I saw you said it all started in my head. So
It's still there.
Any other question? I have a poll for our audience here. I'd like to ask you if you have seen each of the 4 disciplines here, just for curiosity. Okay, so how many of you have actually seen a physiotherapist in your lifetime? Okay, that's about 75–80%. How many have actually seen a chiropractor? Okay, that's probably 85–90%. How many have seen a massage therapist? My hand is down. I've never seen one. Okay, so that's about 65–70%. And what about acupuncture? My hand is down. It's about 40%. Okay, good. That was interesting, I guess.
Very interesting.
So now we know all why benefit plans are going up, because they're using it out there. Great. Hey, thank you so much for your time. We know that you're very busy. You have many clients and many patients. Some are in the group here today, and we really do appreciate your time. All the best to you in your practice. We do see you as partners in business, helping our staff, our employees, address their physical and mental issues, and we appreciate that. You do great work, and thanks very much for coming.